Hi, my name is Jessica Hunter, and this week's assignment we have a scenario, critical thinking questions, and a research question. So for the scenario, it states, EMS team has brought a 54-year-old patient to the emergency department where you are working. The EMS personnel states that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her and then she fell, seriously scraping her arm and face. The woman was bleeding, she was disoriented, combative, and accusing the EMS team of stealing her purse. Her hands were shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. Her clothes are dirty, and she smells of body odor and urine. So for critical thinking question number 1, it asks, based on your first impressions of this patient's actions and appearance, what do you suspect she is suffering from? I suspect that she is suffering from dementia. Signs of dementia is hallucinating, paranoia, falling, and memory loss. I also thought she was suffering from Alzheimer's. So according to the National Institute of Aging, the most common symptoms are loss of cognitive function, which can affect a person's everyday activities. But after further research and investigating, I found out that she might have something called Lewy body's disease. Dementia. Okay, question number 2. What short and long-term health risks would you suspect this patient faces? The risks of Lewy body disease includes changes in thinking and reasoning, confusion, and alertness. The symptoms vary from person to person, from the time of day and time of night. Lewy body dementia also exhibits symptoms of Parkinson's, such as a hunched posture, balancing problems, rigid movement of the muscle. About 1% of elderly people that are 60 and plus have Parkinson's. So it's an uncommon disease. Question number 3. Why do you think the patient's hands are shaking, and what do you think caused her confusion and combativeness? Well, when it comes to the hand shaking, I first evaluated that maybe she had some sort of anxiety, but she seemed very discombobulated, so further thinking it was the symptoms of dementia. So shaking hands could be caused by the Parkinson's symptoms, these resting tremors. The reason for her violence could be due to acting out her dreams, sometimes violent, and a problem known as rapid eye movement sleep disorder. Those cause visual hallucinations, and it could be the reason why she's paranoid. As a nurse, for assessing the patient, blood tests would be taken for Parkinson's, a mental health assessment to see where the patient is, and then medications that will be prescribed accordingly by the doctors. So there's chloralinase inhibitors, rivastigmine, and then for Parkinson's, she would given levodopa to help tremors or slow movement. Now moving on to the research question. Mental illness management includes both pharmacological and therapeutic methods for treatment. Summarize how this managed and the support of insurance. Is it sufficient? What could make it better? Be specific and support your statements with a minimum of 2 outside sources besides the textbook. So, patients will go to a physician for proper mental health assessment. Further decisions will be made by doctors choosing a correct course of action, whether medications or therapeutic. More than 1,500 compounds classify as a psychoactive or a psychotropic. This is according to our textbook. Such as therapies and counseling is usually provided for those after the mental health assessment, or inpatient services, and those even suffering from substance disorders. Market plans can't put yearly lifetime dollar limits on coverage, including mental health care and substance use disorder. Common types of health insurances that are provided are private health insurances, Medicaid, and Medicare. And not everyone gains the same amount of insurances. And is the effect of insurances very significant? Yes, and it depends on the demographic and the age. If I were to make any changes to the insurance plans, it would go through an act of Congress, and then it would take changing hospital routines and then changing different insurance companies. I think the system that we have now is effective and people get the help that they need. I think the Affordable Care Act has been great on younger students just like myself who are still in school, and by the age of 26 we still get to be on our parents' insurance. This was my presentation, and thank you for listening.